Did you know, though DHT causes hair fall in those with androgenetic alopecia, it in fact ironically causes hair growth in your beard. This shows the robustness and the long-lasting nature of beard as a donor area in hair transplant surgery. So your beard could add value to your hair transplant procedure as it does not miniaturize with age. On the other hand, we cannot be sure about the longevity of the scalp donor hair as it tends to miniaturize with time. If you want to know more about the utility of body hair transplant, please stay on. Body hair transplant is one of the few innovative methods adopted by some hair restoration surgeons to improve cosmetic results in patients. It has now become a recognized solution in those individuals with limited donor area hair on the scalp. The FUE, or the follicular unit extraction method of hair transplant, has enabled physicians to harvest follicles from multiple donor areas in the body, which include the beard, the chest, the forearms, or other areas. In this video, I am going to discuss about hair transplant performed with the beard as a donor area. In my practice, I prefer picking up grafts from the shadow areas of the beard so as to avoid even minute scarring over the face. To begin with, the beard can be considered as a donor area only in those men with a dense beard. Many patients who were sufferers of extensive baldness or those who had a very poor donor area density at the back of the head, or even those who ended up having very low reserves of donor hair as a result of multiple hair transplant procedures performed in the past, have greatly benefited from the placement of beard hair on the scalp. Beard hair can also be considered to add extra density in those individuals with very fine scalp hair. The average diameter of the beard hair is around 0.75 millimeters. In contrast, the average diameter of the hair on the scalp is only about 0.23 millimeters, and that of the hair on the forearms or on the legs is around 0.3 millimeters. This data itself shows the excellent caliber of beard hair. In other words, the optical density provided by coarser hair would be significantly greater than the optical density provided by the placement of finer hair. Moreover, hair with a larger caliber tends to be sturdier and more resistant to the potential damage caused during handling in a hair transplant procedure during the plantation process. Patients with something known as a shepherd's crook type of scalp hair, that is, those with scalp hair with curled follicles, can have better results if instead of taking hair from the scalp, grafts were harvested from the beard. These troublesome curled follicles increase the difficulty of harvesting intact grafts, hence making the harvesting process more tedious and also less productive. The beard grafts of patients with shepherd's crook type of scalp hair is usually considerably less curled than the hair on the scalp. Thus, FUE from the beard region in these patients is more advantageous and typically improves the yield of grafts. So as a patient, you might wonder, how is a beard to scalp hair transplant different from a normal hair transplant? Well, firstly, patients are asked to shave off their beard 3 days prior to the day of surgery. During these 3 days, they should not trim or shave the beard. This gives your physician a perfectly comfortable length of hair to operate on. Many patients might end up feeling apprehensive about the pain that they might feel in the beard area. Well, no procedure is completely painless. However, if the right technique is used to infiltrate local anesthesia, the patient does not feel more than 2 pricks during the entire procedure. So I've briefly given you an idea about beard to scalp hair transplant. However, if you have any questions to ask, please leave a comment in the comment section below. Thank you.